Which of the following diseases was eradicated globally due to successful vaccination campaigns? A. Polio. B. Smallpox. C. Measles. D. Tuberculosis. The correct answer is B. Smallpox is a highly contagious and deadly viral disease that has been eradicated globally through widespread vaccination efforts. The last naturally occurring case of smallpox was reported in 1977. Which of the following diseases is caused by a deficiency of insulin? A. Alzheimer's disease. B. Diabetes mellitus. C. Heart disease. D. Hyperthyroidism. The correct answer is B. Diabetes mellitus is a metabolic disorder characterized by high blood sugar levels. It is caused by either a deficiency of insulin, type 1 diabetes, or insulin resistance, type 2 diabetes. Insulin is a hormone produced by the pancreas that regulates blood sugar levels. Carcinoma arises from which type of cells? A. Muscle cells. B. Epithelial cells. C. Nerve cells. D. Bone cells. The correct answer is B. Carcinoma is a type of cancer that originates in epithelial cells, which are the cells that line the surfaces of the body, such as the skin, internal organs, and glands. BMD test is done to detect A. Dengue. B. Malaria. C. Osteoporosis. D. AIDS. The correct answer is C. BMD stands for bone mineral density. A BMD test is used to measure the density of minerals, primarily calcium, in bones. It is a common diagnostic tool for osteoporosis, a condition characterized by weakened and brittle bones. Which disorder is characterized by progressive loss of memory and cognitive function? A. Parkinson's disease. B. Alzheimer's disease. C. Multiple sclerosis. D. Epilepsy. The correct answer is B. Alzheimer's disease is a progressive neurodegenerative disorder that primarily affects memory, thinking, and behavior. It is characterized by the buildup of abnormal protein deposits in the brain, leading to the loss of brain cells and the disruption of communication between neurons. Human immunodeficiency virus, HIV, causes illness by attacking a type of white blood cell called A. B cells. B. Neutrophils. C. CD4 T cells. D. Eosinophils. The correct answer is C. HIV primarily targets CD4 T cells, which are crucial components of the immune system. These cells play a vital role in coordinating the body's immune response to infections. HIV destroys CD4 T cells, weakening the immune system and making individuals more susceptible to opportunistic infections and certain types of cancers. Which of the following immunosuppressants helps prevent transplanted organs from being rejected in recipients? A. Etoposide. B. Cyclosporin. C. Itraconazole. D. Aspirin. The correct answer is B. Cyclosporin is an immunosuppressant drug commonly used in organ transplantation to suppress the immune system's response and prevent organ rejection. It inhibits the activation of T cells, which are key players in the immune response. What condition occurs when the immune system mistakenly attacks the insulin-producing cells in the pancreas? A. Type 2 diabetes. B. Type 1 diabetes. C. Cushing syndrome. D. Parkinson's disease. The correct answer is B. Type 1 diabetes is an autoimmune disease in which the body's immune system attacks and destroys the insulin-producing beta cells in the pancreas. Insulin is a hormone that regulates blood sugar levels. TB vaccine is useful against A. Polio. B. Dysentery. C. Malaria. D. Typhoid. The correct answer is D. TB vaccine, also known as typhoid paratyphoid A and B vaccine, is used to protect against typhoid fever. Typhoid fever is a bacterial infection caused by Salmonella typhi. Which of the following diseases is also known as the kissing disease because it is spread through saliva? A. Influenza. B. Mononucleosis. C. Mumps. D. Measles. The correct answer is B. Infectious mononucleosis, commonly known as mono or the kissing disease, is caused by the Epstein-Barr virus, EBV. It is spread through saliva and can be transmitted through kissing, sharing utensils, or close contact with an infected person. Which organ is affected by diphtheria? A. Throat. B. Brain. C. Liver. D. Skin. The correct answer is A. Diphtheria is a serious bacterial infection that primarily affects the mucous membranes of the throat and nose. It can cause a thick gray coating to form in the throat, making it difficult to breathe. Which of the following vaccines is primarily used to prevent pneumonia? A. Influenza vaccine. B. Pneumococcal vaccine. C. MMR vaccine. D. Hepatitis B vaccine. The correct answer is B. Pneumococcal vaccines are designed to protect against infections caused by Streptococcus pneumoniae, a bacterium that can cause pneumonia, meningitis, and other serious illnesses. Consumption of high levels of nitrates can lead to which of the following conditions? A. Blue baby syndrome. B. Scleroderma. C. Osteoporosis. D. Hypothyroidism. The correct answer is A. Blue baby syndrome, also known as methemoglobinemia, can be caused by high levels of nitrates in drinking water. Nitrates can convert hemoglobin in red blood cells into methemoglobin, which is unable to carry oxygen effectively. This can lead to a bluish discoloration of the skin, especially in infants. Which of the following diseases is related to abnormal hemoglobin in red blood cells? A. Sickle cell anemia. B. Thalassemia. C. Leukemia. D. Both A and B. The correct answer is D. Both sickle cell anemia and thalassemia are genetic blood disorders that involve abnormalities in hemoglobin, the protein in red blood cells responsible for carrying oxygen. Sickle cell anemia is characterized by abnormally shaped red blood cells, while thalassemia involves reduced production of hemoglobin. Which disorder is associated with the loss of myelin sheath around nerves? A. Alzheimer's disease. B. Multiple sclerosis. C. Epilepsy. D. None of these. The correct answer is B. Multiple sclerosis, EMS, is an autoimmune disease in which the body's immune system attacks the myelin sheath, the protective covering of nerve fibers in the central nervous system. This damage disrupts the transmission of nerve signals, leading to a wide range of neurological symptoms. Which disease is characterized by abnormal cell division in white blood cells? A. Hemophilia. B. Leukemia. C. Anemia. D. Ischemia. The correct answer is B. Leukemia is a type of cancer that affects blood-forming tissues, including the bone marrow and lymphatic system. It is characterized by the uncontrolled growth and proliferation of abnormal white blood cells, disrupting the normal production of blood cells. Minamata disease is caused by consuming fish that contain high levels of which of the following substances? A. Lead. B. Arsenic. C. Methylmercury. D. Cadmium. The correct answer is C. Minamata disease is a neurological disorder caused by severe mercury poisoning. It is primarily caused by the consumption of fish contaminated with methylmercury, a highly toxic form of mercury that accumulates in the food chain. Melanoma is a type of cancer that develops from which of the following cells? A. Osteocytes. B. Melanocytes. C. Fibroblasts. D. Lymphocytes. The correct answer is B. Melanoma is a type of skin cancer that develops from melanocytes, the cells that produce melanin, the pigment that gives skin its color. Which genetic disorder is characterized by progressive muscle weakness and loss of muscle mass? A. Hemophilia. B. Muscular dystrophy. C. Down syndrome. D. Turner syndrome. The correct answer is B. Muscular dystrophy is a group of genetic disorders that cause progressive weakness and degeneration of the muscles. It is caused by mutations in genes that are responsible for the structure and function of muscle fibers. Which disease is transmitted by mosquitoes? A. HIV, AIDS. B. Hepatitis B. C. Malaria. D. Asthma. The correct answer is C. Malaria is a mosquito-borne infectious disease caused by parasites of the genus Plasmodium. It is transmitted through the bite of an infected female Anopheles mosquito. Which disease is caused by a deficiency of dopamine in the brain? A. Parkinson disease. B. Multiple sclerosis. C. Epilepsy. D. Alzheimer's disease. The correct answer is A. Parkinson's disease is a neurodegenerative disorder that primarily affects dopamine-producing neurons in a specific area of the brain. This deficiency in dopamine leads to the characteristic motor symptoms of Parkinson's disease, such as tremors, rigidity, slow movements, and difficulty with balance. Which condition is characterized by frequent, uncontrolled electrical activity in the brain? A. Parkinson's disease. B. Epilepsy. C. Stroke. D. Multiple sclerosis. The correct answer is B. Epilepsy is a neurological disorder characterized by recurrent seizures, which are caused by abnormal electrical activity in the brain. What is the main symptom of jaundice? A. Red skin. B. Yellowing of skin and eyes. C. Swelling of joints. D. Dizziness. The correct answer is B. Jaundice is a condition characterized by a yellowish discoloration of the skin and whites of the eyes. It occurs when there is an excess of bilirubin, a yellow pigment, in the blood. Hemophilia is known as the failure of A. Heart to contract. B. Kidney to filter. C. Stomach to digest. D. Blood to clot. The correct answer is D. Hemophilia is a group of inherited bleeding disorders characterized by the inability of blood to clot properly. This is due to deficiencies in certain clotting factors, which are proteins essential for the coagulation cascade. A kind of injury or damage that results in the premature death of nearby cells in a tissue or organ through autolysis is called A. Apoptosis. B. Necrosis. C. Inflammation. D. Regeneration. The correct answer is B. Necrosis is a type of cell death that occurs due to injury, disease, or other factors. It is characterized by the premature death of cells and the disruption of cell membranes, leading to inflammation. Which of the following diseases is caused by bacteria? A. Diabetes. B. Typhoid. C. AIDS. D. Cancer. The correct answer is B. Typhoid fever is a bacterial infection caused by Salmonella typhi. It is usually spread through contaminated food or water. Which salivary gland is most commonly affected by sialolithiasis? A. Submandibular gland. B. Parotid gland. C. Sublingual gland. D. Minor salivary gland. The correct answer is A. Sialolithiasis refers to the formation of stones within a salivary gland or its duct. The submandibular gland, located beneath the jaw, is the most common site for sialolithiasis. What rare disorder caused by the buildup of fluid in the brain is commonly treated by surgically inserting a shunt to drain excess fluid? A. Hydrocephalus. B. Epilepsy. C. Parkinson's. D. Meningitis. The correct answer is A. Hydrocephalus is a condition characterized by an abnormal accumulation of cerebrospinal fluid, CSF, in the brain. This buildup of fluid can increase pressure on the brain, leading to various neurological problems. Shunt surgery is a common treatment for hydrocephalus. What is the primary cause of coronary artery disease? A. Bacterial infection. B. Cholesterol buildup. C. Viral infection. D. Lack of exercise. The correct answer is B. Coronary artery disease, CAD, is a condition in which the arteries that supply blood to the heart muscle become narrowed or blocked. The most common cause of CAD is atherosclerosis, the buildup of cholesterol and other fatty deposits on the inner walls of the arteries. Which of the following is the combined vaccine given to children for protection against tetanus, whooping cough, and diphtheria? A. MMR vaccine. B. DTaP vaccine. C. IPV vaccine. D. HIV vaccine. The correct answer is B. DTaP vaccine is a combined vaccine that protects against diphtheria, tetanus, and pertussis, whooping cough. It is typically given to children in a series of doses.